The state nursing union today leveled strong accusations against the state's two largest hospitals.
Yeah, they say that more than 250 Maine Med nurses have been seriously injured, they say, in attacks involving patients or family members, forcing them to take time off from work.
CBS 13 Brad Rogers looks at the impact nurses say this has on patient safety, which the hospitals strongly deny.
We are here today to call on management to address our concerns on workplace violence and safe patient staffing.
Members of the Maine State Nurses Association blame chronic staffing shortages and often high patient-to-nurse ratios for an increase of violence at Maine's two largest hospitals.
My coworkers have been punched in the face. One had their nose broken. I personally have been hit, kicked, spit at.
They want metal detectors at all hospital entrances.
Come across a lot of weapons that have made their way into the hospital. We have had people bring in weapons with intent to harm.
Indeed, we are seeing increased threats against staff.
Faye Weir heads Patient Support Services at Maine Medical Center. She says the nursing union demand to mandate the number of patients they see is not the answer.
Mandated nurse-to-patient ratios doesn't do anything to increase nurse safety or staff safety.
However, nurses say when they're stretched thin by being constantly asked to do more with less, it leads to more patient falls, bed sores, medication errors, and negative outcomes.
Nurses are rushing from one room to the next, frantically juggling care for too many patients.
Some hospitals say a nursing shortage is part of the problem. Maine Med has hired hundreds of nurses in the last 3 years, but retention is an issue.
There is not a nursing shortage. There is a shortage of nurses that are willing to work in the hospital under those conditions.
The head of nursing and patient care at Northern Light Eastern Maine Medical Center told us nurse staffing levels are in line with other hospitals and are not impacting patient care. We asked, what is your response to what nurses are saying? In a statement, Deborah Sanford told us we monitor patient volume and acuity and ensure our day-to-day staffing enables us to provide the high quality of care our patients have come to expect. But the nursing union argues the basic needs of patients are not being met in the state's largest hospitals because they're overworked.
The time has come for our hospitals to implement safe patient ratios.
Brad Rogers, CBS 13 News.